Well, hello everyone. I'm Cambridge Mayor Catherine Nagari, and today I'm here with Patrick Gaskin, President and CEO of Cambridge Memorial Hospital. And I'm delighted that Patrick has allowed us to have a few minutes of time, really just to talk to our community about what's going on. So welcome, Patrick, and thank you for joining me. So I wanted to ask, what's been happening at CMH over the last 2 months as COVID-19 pandemic has arrived in Cambridge and indeed has changed world as we know it?
Well, Catherine, it's been a whirlwind, so it's hard to summarize 2 months in just in a short time. But really, we've worked across the system, both locally and regionally, to respond to COVID and the pandemic. So at the local level, we've opened up new beds. We've opened up a testing center to work with public health so that we're testing people. At the regional level, we worked with the other hospitals to make sure we're coordinating care and offering the best care possible. It's been a whirlwind for that, and the community has stepped forward and been so supportive.
And I would say that too. It's what I've been getting at our weekly updates with the medical officer of health. If you could pick one thing, what has seemed to be the biggest challenge during this pandemic?
The first one was our personal protective equipment, making sure we kept our patients and our staff safe. And I'm so proud of the fact that we've never been in a situation where we had to put anyone at risk. We've always had the personal protective equipment. As we've been able to secure that, and we're not quite out of the woods yet, but as we've been able to secure more personal protective equipment, I think our next biggest challenge is starting to reintroduce services. What is that new normal going to look like? How are we going to start doing elective surgeries, scheduled surgeries, things like that? That, I think, is the biggest challenge that awaits us.
I would say so, and I've been pretty proud of our local community stepping up to try and resolve some of the PPE or personal protective equipment that we're talking about. I know that there are all kinds of folks that have been sewing cloth masks, for instance, to give out. And we've had other companies stepping forward to help resolve some of the personal protective equipment across not just Cambridge and the region, but indeed Ontario, which has been great. If you were able to even talk about maybe a surprise, what would have surprised you either about your staff or the community in responding to this pandemic?
I just want to build on what you said, Catherine, there for that. That probably just the way everyone responded, and maybe that's not a surprise for that. But the boxes, whether it's from the dental clinic that sent us boxes of gloves and masks for that, whether it's the sewn mask, whether it's been Eclipse Automation that is working with how to secure and make N95s here locally, and we've been working with Steve Mine, his team for that. It's just been kind of across Conestoga College loaning us equipment for that. It has just been an incredible show of support. It's amazing how, and it should not be a surprise how the community has rallied from the business, from people, from the messages of support, the rocks in our garden. It's been that's been the wonderful, treasure of this whole pandemic.
Yeah, and I would agree. It's been fun to kind of follow some of the social media posts about different photographs and lots of messages of support. And of course, it's Nurses Week. And I remember when I worked as a nurse in the emergency and intensive care units at Cambridge Memorial Hospital. And, I remember the way it was set up when we were dealing with the SARS epidemic in 2003. And with many beds, an emergency department just separated by curtains, which meant little privacy or, poor infection control. So thank goodness that in January, the new emergency ward and the new wing of the hospital opened up. So how do you think that the situation has been, I think, improved with the new wing being opened?
Well, Catherine, it couldn't have come at a better time, as you said. Mid-January, we opened it. Mid-March, we're in the midst of a pandemic. So let's take the emergency department, as you said. And first of all, Catherine, happy Nurses Week to you. I think they always say Once a nurse, always a nurse. Maybe they say
Oh,
once
yeah.
a nurse, always a nurse, and sometimes a mayor for that. Maybe that's the tagline in it for that. But happy Nurses Week
Thank you.
to you. So let's just take the emergency department as an example. As you know, it's 3 times the size. It has every single stretcher bay is a private room. We have 2 negative air pressure rooms in the emergency department. One is in our has our full resuscitation equipment in that. So again, being able to be ready for a pandemic, it came at a great time for this community in terms of having a top-notch hospital to be able to respond.
It truly is amazing. And those services were not there when I was there, covered in my N95 mask and cap, gown, mask, gloves, and the whole 9 yards when I was caring for the patient. So, and again, my congratulations to all nurses and all healthcare and frontline workers at the hospital. But are you able to celebrate Nurses Week this week? And if so, how are you showing the nurses that we all care for them?
Well, we started the week with chocolate, and so that was good for that. Not only for the nurses, but we were kind enough with a community donation to have chocolates for everybody on Monday morning. And so, first of all, extended to you, but to all the Cambridge Memorial Hospital nurses, Happy Nurses Week, and all of the nurses in Cambridge North Dumfries, Happy Nurses Week. At the hospital, like nurses contribute across the organization, the front line of care, clearly the front line of care, in support service departments that you wouldn't think of, like our information technology department, infection control, and obviously at the executive team, that we have nurses at the executive team as well for that. So they make a huge impact. And we could not do what we do without the nurses, the 400 plus nurses that we have in the hospital. They truly make a difference. And while we celebrated different this week, differently than we have in previous years, it's been a wonderful way to celebrate the core, the backbone of our hospital, our nurses.
Well, that is wonderful. And I'm still a registered nurse, just non-practicing. So again, I really do relate. So in closing, Patrick, I really appreciate the time you spent with us, but I know that there's ways that people want to help the organization and the staff at Cambridge Hospital. If you were to ask our community for anything, how would you ask for that support?
Well, thanks, Catherine, for asking. And I think when people have asked, what can we do? I talk about it, given my name is Patrick, in terms of the 3 Ps that I say for that. So the first P is patience. And as we enter into what the new CMH will be and how things will look differently, we are excited, as I said, about starting services and being able to offer services for patients who have been waiting for services for that. And so kind of the patience as we work through what those new processes will be. The second is for both the hospital and the community as a whole, I'll call it the P for pocketbook. I know it's been a tough time for people, but how they can contribute, whether it's supporting the hospital, whether it's supporting the self-help food bank. There's people in our community we know that need a hand at this time. It's been a tough time for people over the last 8 weeks for sure. So those that can through their pocketbook be able to support the hospital. And the final thing that for the community as a whole, I know, Catherine, it's a message you've been proposing or promoting as well, is precautions. Keep doing what we've been doing. The social distancing, don't go out if you're sick, don't go to work if you're sick, stay away from keep your hands away from your face, wash your hands, all of the things that we've been doing to flatten the curve. Come on, Cambridge North Dumfries, let's keep doing it as well.
Well, and that is a great message, better said from you than me someday. So again, I really appreciate you coming before us and giving us a message directly from the hospital. And on behalf of myself, City Council, and a very grateful community, thank you, Patrick, for all that you're doing, your senior team, and all of your staff. This is an amazing facility. And Cambridge Memorial Hospital is just a jewel in our community, and we could not be prouder of the work that you're doing each and every day for all of us. Thank you.
community supporting us, and we would not be here without the amazing staff that we have, physicians, nurses, midwives across the organization, our volunteers who we miss, and a community who's been so supportive for us. And we'll be here always to support Cambridge North Dumfries. It's so important to us. Thanks for the time, Catherine. Really appreciated our time together.